Polycystic ovarian syndrome, PCOS, and thyroid disorders are two of the most common hormone disorders in women. We often see women presenting with both of these conditions. Is there a connection? In this podcast episode, we'll discuss the relationship between PCOS, thyroid conditions, Hashimoto's, that's our gig, in particular, hair loss, and what you can do to start feeling better.
Hello, thank you for listening to Thyroid Hair Loss Connection podcast, a science-based, honest, candid conversation about how your thyroid affects your hair. You will learn practical solutions to hair growth, healing your thyroid, and balancing hormones with holistic nutrition approach and the latest treatments. Your hosts, me, Nataliia Sanzo, a registered dietitian, aka Nashville thyroid expert, and Kimberly Vaughn, a board-certified trichologist, hair loss specialist, and coach. To stay up to date on the latest topics, make sure to subscribe to our channel. We also cannot do this without you. Send us a question to the link below and tune in each week for the answers. Now, let's head to the show. Hello, listeners. Good morning, Kimberly. How are you doing today?
I'm doing great, Nataliia. How are you?
I'm doing fantastic, and I'm so excited about today's episode. You guys have been asking us to cover PCOS, and we are so proud to have an expert in this field on our panel. Listeners, let me introduce you to Dr. Lynn Ellington. She's a board-certified OBGYN with 27 years of experience in private practice. Dr. Ellington completed medical school at Vanderbilt University, graduated from residency training in obstetrics and gynecology at the University of Kentucky. She's also a founding and managing partner at Women's Group of Franklin, which is a private practice in Franklin, Tennessee. Dr. Ellington is also a fellow of American College of Obstetrics and Gynecology. Dr. Ellington, thank you so much for taking the time out of your busy day to join Kimberly and I on our podcast to talk about polycystic ovarian syndrome.
Well, it's great to be here. I'm glad to join you and have this discussion.
Yes, we're so lucky to have you here because when you showed up here in this podcast recording studio this morning, you said that you were you delivered 4 babies after midnight today.
Yes.
Right? That's today.
Yes.
So we really appreciate your time.
All right.
And so lucky to have you here. So let's jump into talking about PCOS. How prevalent is PCOS in your practice, and what are some of the common symptoms?
PCOS is very prominent. Up to 10 to 15% of all women have PCOS during their reproductive years, and the hormonal changes can even continue into menopause. Some of the common symptoms of PCOS are obesity, excess hair growth on the face, especially the upper lip and the chin, loss of hair, thinning hair. Patients are higher risk to have diabetes. They have a higher risk of uterine cancer, and very often they have reproductive difficulties, such as getting pregnant because of the lack or infrequency of their periods.
That's an extensive list, and funny enough, or how weird is it that all these symptoms correlate or cross with Hashimoto's symptoms, with autoimmune thyroid disease? Do you have a lot of women that have Hashimoto's and PCOS in your practice?
Yes, I see a lot of patients that have both, but they each can still be independent of each other.
Right. Of course. So because PCOS is not defined clearly, right? It's not a real diagnosis. We just have a bunch of symptoms that we put it all together. So if it's not clearly defined, how do you diagnose PCOS? What are some of the diagnostic criteria?
Well, there's 3 basic diagnostic criteria for PCOS. One is that, as the name suggests, if you look at the ovaries on ultrasound, there are very tiny cysts that we see on the ovaries. A normal ovary will produce a dominant cyst every month, and that is how our ovarian cycles continue and how we ovulate and can create pregnancies. But polycystic ovaries tend to not have the same hormonal function, so they don't get a dominant cyst. They just have all these little tiny cysts fighting to be the king of the mountain, as I put it, and trying to have power. And they kind of battle your hormones against each other in a way that keeps you from having the normal hormonal function that you should. Another criteria is to have what we call oligomenorrhea, which is the absence of or less frequent periods than the average person. So if your periods are more than 35 days apart, or if you're having periods that 1 month are 21 days apart and another month are 45 days apart, that's very characteristic of polycystic ovarian syndrome. So the third diagnostic criteria is hirsutism, which is the medical term for excessive hair growth. I have patients that have hirsutism that they don't think much of it because it's the way they've always been. And I also have patients that just show up and suddenly their hair starts growing crazy and they just don't understand why, but that can be part of the syndrome. So in the medical world, we have to have 2 of the 3 criteria, either the ultrasound findings, the hair growth, or the oligomenorrhea to officially make the diagnosis of PCOS. However, there are a lot of doctors that use other criteria and lab tests, so it is, as you said, a not very clearly defined diagnosis. Mm-hmm. It's more, as we say, a syndrome that some people have some characteristics and some people have others.
Mm-hmm. Wow, that's just so interesting. So at HPI Hair Partners, we do treat a lot of women with PCOS. We certainly see the issues of the excessive hair, and then we also see the excessive hair loss. So a couple of questions that might be helpful for the listeners. Mm-hmm. So if they're starting to experience, some of the unusual hair growth or hair loss, if they're having irregular periods and this has been going on for some time, is it normal, I guess, is the only way I know how to put it, that if they go to their gynecologist and say, why is all this happening? Let's just say they perform an ultrasound. Will the cyst be abnormal in that first ultrasound, or is it something that you kind of have to track, because how do you know if your periods are irregular, right? Mm-hmm. Unless you truly track them every month and then you count the days and then you go through this series of 3 to 6 months of all these irregularities.
So on the ultrasound, the cysts usually are present in PCOS, but there are patients that don't have the cysts, or we can look one time on ultrasound and we see all these little tiny cysts, and then another time we don't. And that's just because our ovaries are very finicky, as I put it. Sometimes they are behaving right, and then other times they decide they just don't want to behave right for a month or 2. So I do see some patients that we truly classify as PCOS, and then I'll see them for their next visit, and they say, well, for the last 6 months, my periods have been fine. So some people do kind of shift their hormones in and out of normalcy.
Mm-hmm. The other thing that we notice a lot when we run labs, Dr. Ellington, is that the testosterone levels are elevated in these individuals. And certainly that's kind of what we do. We start with the labs and then we go, here, Dr. Ellington, take care of this patient, right? Is that something that the listener should also pay attention to, that if those testosterone labs are running high, that could also be a diagnosis or an indicator of this syndrome?
Yes. One of the most common reasons for testosterone to be high in women is PCOS. If they're extremely high, we worry about tumors that can be growing in the ovaries or on the adrenal gland above the kidney. But the majority of people that have elevated testosterone, it's kind of in the low elevated range. Some people with PCOS, their testosterone is even normal. It's just that their sex hormone binding globulin that carries the testosterone around in the body is abnormal. So they have a normal testosterone, but they are exhibiting excess testosterone in their body because of the way their body metabolizes it. Mm-hmm. So it is a very confusing thing for a lot of patients. And sometimes I really have to sit down with them and explain one-on-one what their values mean. And even if they have excessive hair growth, for example, or losing hair, just because their testosterone level is normal doesn't mean that we can't focus on trying to get that level even lower with medical treatment to help their syndrome.
Oh my gosh, Nataliia, we have to have her back all the time. She's like speaking right up our language. Listener, you better stay tuned because this is good. You better hang in there.
Dr. Ellington, since we're talking about signs and symptoms, can we touch on the topic of types of PCOS? I'm sure there are people come to you and saying, oh, I am type whatever, and they're actually on social media. There are 4 types of PCOS that you can be treated for, apparently. It's insulin-resistant PCOS, inflammatory PCOS, adrenal or post-pill PCOS. And apparently people prescribing diets and protocol depending on the type of PCOS you have. Is there such a thing?
I think there are some people that have the opinion that they want to divide it into different categories, but I feel that they're all different variations of the same theme. There's different characteristics of how insulin resistant you are, but all PCOS patients could have phases of insulin resistance or some degree of it at any time. Same thing with all of the other characteristics.
So in your practice as a medical doctor, do you guys have a protocol that all your PCOS patients fall under and that's how you're treating?
Yes and no. In medicine, the number one regulating medicine for PCOS is birth control pills because it takes over the function of the ovary and it pretty much makes the ovary dormant during the time that you're treating it. So that is the mainstay. But we also do individualized therapy for people that, for instance, if they're insulin resistant, they need to have a appropriate diet and, work on their weight control. And as I tell my patients, sometimes you don't know whether the chicken or the egg came first. We don't know if the obesity leads to PCOS or the PCOS leads to obesity. But if you don't address both of them, you're not going to be fully treating the patient.
Absolutely. It has to be a personalized approach. So taking a test online to figure out what PCOS type you have, I think it's the wrong approach.
Yes,
it's the
ma'am.
wrong starting point. It can be very overwhelming and expensive because apparently there are PCOS supplements out there marketed towards it, which we know it's just a waste of money. Because with the main points we need to address is, like you said, insulin resistance, weight management, lifestyle, right? So I think those are 3 pillars that we work as a team. So let's kind of circle back and talk about PCOS and Hashimoto's. So like I said, unfortunately, I see a lot of people with PCOS because people with PCOS or women with PCOS are 3 times more likely to have Hashimoto's and vice versa, right? And there's not really a connection. We don't know which one starts first, right? Chicken or an egg. But we do know that there are 3 possible explanations of why, for example, PCOS leads to Hashimoto's or vice versa. Is the first hormonal imbalance, right? We know that Hashimoto's is an autoimmune thyroid disorder that affects thyroid gland, which produces hormones that regulates metabolism, right? And if your metabolism is all over the place, it also affects other hormones like your estrogen, testosterone, progesterone. So maybe Hashimoto's leads to PCOS from hormonal imbalance. And then, of course, inflammation. That's another second possible reason because we know Hashimoto's is an inflammatory disease, and we kind of put PCOS under that umbrella as well, right? It leads a lot of systemic inflammation because it affects so many systems in our body, right? Especially blood sugar. And finally, genetics. There is actually maybe a genetic link between PCOS and Hashimoto's, and it was fascinating when I was preparing for this podcast. I found a study in 2013 that suggested that PCOS may be a kind of autoimmune disease. Mm-hmm. And
that is a theory, but I don't think anyone has scientifically proven that, but there's ongoing studies all the time.
Mm-hmm. So, Dr. Ellington, we just talked about how PCOS and Hashimoto's go hand in hand, but we're missing a third important part, is the hair loss that comes with PCOS and Hashimoto's. So I think those three things first go hand in hand, and I'm so glad three of us here today are talking about to address it from a multiple aspects of it. So Kimberly, Dr. Ellington mentioned that one of the symptoms of PCOS is hair loss, right? Can you talk about PCOS hair loss and how it differs from other types of hair loss?
Sure. I'm so glad you asked. So, actually, what I want to do for the listener is just talk about two things. So the first is this irregular hair growth, right? And so for a female to start growing hair on her chin or her cheeks at early ages, typically we can say, well, that certainly isn't postmenopausal, right? Hormone adjustments. So that also came up in one of your first areas of diagnoses, right? And, and so let's put that one on the side for a moment, and let's go back to, as Nataliia was saying, talking about those individuals with hair loss, right? So PCOS, Hashimoto's certainly top contributors to hair loss from the course of male pattern thinning from frontal hairline to crown, or female diffuse thinning from frontal hairline to the nape of the neck down to the ears. When we look at PCOS patients, though, and we talked a moment ago about their testosterone levels, how should the individual listener think, okay, well, my hormones are not in balance. Do I have PCOS? Do I have Hashimoto's? What do I have? What's causing this hair loss? And for us, that's our core of the reason patients and clients come to see us, is what truly is that root cause. Mm-hmm. And that's always so important on our podcast, is talking to the individuals that you really need to get to the root cause. Mm-hmm. So when we think about that, what labs, or do you run labs? What do you recommend? I mean, how can this individual who maybe has two of the symptoms out of three, maybe has been Googling, and is thinking that, they have insulin dormant PCOS or insulin dominant PCOS, how do they figure out what they should do next?
Well, our basic lab panel that we have is set to look for not only do they have PCOS, but if they have PCOS, are we taking proper care of them to make sure that they're addressing the things they need to address? That panel would include a total testosterone. That would tell us if the testosterone level, again, is elevated, but even if it's not elevated, they can still have the excessive hair because of the way their body metabolizes the testosterone. We look at the thyroid function, because sometimes it is the culprit of the thyroid. So you adjust the thyroid, which can be either hypo or hyper. We give them medication to adjust those levels, and sometimes that helps with the hair loss. We look at a 17-hydroxyprogesterone that looks for adrenal hyperplasia. Sometimes when the adrenal gland, which is that gland that sits on top of the kidney, that does a lot of our cortisol and other hormonal functions, it can show signs of those hormones being off, and they can also influence the function of the thyroid hormones as well as the testosterone. We also look at a hemoglobin A1C and their glucose, and can even do a glucose challenge test to test them for diabetes, because as we know, many people with PCOS are either pre-diabetic or truly diabetic. So we have to address that dietary aspect as well.
Mm-hmm. Absolutely.
And tell me again what the adrenal test is called, because I'm wondering, is that something that the listener could ask their physician to run for them?
Absolutely.
Okay.
It's called 17-hydroxyprogesterone. It's usually drawn first thing in the morning when the patient is fasting. It gives a more accurate level.
Okay, great. Excellent. So once we run these tests, and then when you take a look and they come back, I guess getting to, again, the root of where this hair loss and the culprit is. If these levels are irregular, it certainly then leads you down the road that PCOS could be a driver behind this hair loss.
Yes, ma'am.
And so I think for the listener, no different, Nataliia, what you and I have talked about so many times is that making sure that they're being in charge of their medical care. And if they're seeing any of these symptoms, then they really need to find a provider that would be able to run some of these additional tests.
Yes.
Because, again, it really comes down to what is the driver and the root cause of that hair loss, right? I mean, you can treat PCOS all day long, but if it's just a straight up genetic hair loss issue, it's a very different protocol that you take this individual down. So I think it's important just for that precision medicine, for that take charge of your body and what's going on with you, which would be a big help for those who feel like they have some of these symptoms.
Yes.
Absolutely. So it's important to know your symptoms, or identify a set of symptoms correctly, right, to treat PCOS. And you mentioned some of the treatments is a birth control pill. Is there anything else our listeners can look for or ask their doctor as far as the medical treatment goes?
Yes. For excessive testosterone, there is a medicine we use called spironolactone that helps to reduce the testosterone level. The frustrating thing for patients, though, is they aren't necessarily going to see the hair they already have fall off. It's just going to prevent them from developing more abnormal hair. So we usually encourage them to do that in conjunction with some form of hair removal, whether that be laser or whatever technique they choose. But if they don't address the core problem of the hormones, you can spend thousands and thousands of dollars on a treatment and your hair's going to grow back. So you have to approach it from both aspects.
Well, and that's so important because our laser hair reduction services for our PCOS patients, we make sure that we typically start all those treatment cycles at least with 8 treatments. And many times we'll see those individuals for touch-ups throughout the course of the year. Because again, the traditional growth cycle as we know it is totally out the window with this condition.
Yeah.
So yeah, very, very good point.
Okay, so we covered medical management of PCOS, topical and hair care procedures that you can do for PCOS-related hair loss. So now let's talk about nutrition management. We need to focus on the main root causes or drivers of most PCOS symptoms, right? Like Dr. Ellington, you said insulin resistance, it's the main one, inflammation. Then we have to address our gut health, right? Because that's all... everybody says all the disease start in the gut. So we cannot not talk about it. And of course, hormone imbalance, estrogen, progesterone, testosterone, our adrenals and all that stuff. But it's harder to manipulate those hormones with diet.
Yes.
So I think it's very important for our listeners to understand that diet and lifestyle changes play a huge role in management of PCOS. But if your testosterone is high or estrogen is low or high, whatever the extreme is, low or high, you have to address it from a medical point, right?
Yes. Yes. You have to have some help in that department.
Absolutely. Yes. It doesn't matter how much soy you eat. You will not decrease your estrogen levels enough to that point. So let's talk about the most important one, how to manage blood sugar and decrease inflammation with PCOS. Of course, diet and exercise are the most fundamental ways for you listeners to manage insulin levels and control PCOS symptoms because, of course, Dr. Ellington, people can take diabetes medication, right, to control their insulin levels. But if we can prevent the development of diabetes, we want to do it the natural way, right? Through diet and exercise.
Yes.
So let's talk about some tips on eating for PCOS to help you guys get started. So the first one I recommend always is eating foods with low glycemic index. And low glycemic index foods can improve and help balance insulin levels. And insulin resistance, and like we talked about, is a hallmark feature of PCOS, right? It's like the most important one. Insulin is a hormone responsible for lowering blood sugar levels after a meal. And if you have insulin resistance, your cells do not properly respond to insulin, right? So this causes your blood sugar levels to remain elevated for longer than normal, which can worsen inflammation and all of the PCOS symptoms, right? Mm-hmm. And just for our listeners to understand that the glycemic index is the measurement of how food affects your blood sugar, right? It's based on how fast the body breaks down any carbohydrate containing foods down into glucose. And higher the number, from about 70 to 100, indicates that the food will cause a faster increase in blood sugar levels, while lower foods that below 50 or below 70 represent foods that cause a more gradual rise and typically less of a drop.
Mm-hmm. Nataliia, let me jump in a second. So, sadly, the United States, our obesity level is just rising crazy every single month. Mm-hmm. So when we talk about insulin and we talk about obesity or weight gain, loss, are there any medications that an individual might be taking to help them from the insulin regulation perspective mm-hmm. that could be a negative effect on PCOS, mm-hmm. on their hair growth, on their hair loss, right? Because you talked a little bit about birth control pills help regulate spironolactone, help lower testosterone. Mm-hmm. We have a great diet that we share with clients on how to lower testosterone naturally. But how does all this fit together? I mean, because the poor consumer is going, oh my gosh, I mean, what do I take? Nobody's managing it all. Yeah. How do I know?
Yeah. Well, there's so many things that are interrelated in this condition, as we can even see by the three of us sitting here talking about it with three different disciplines mm-hmm. that we specialize in. The glycemic index is, of course, important, trying to stay on the low glycemic index. The medication that is most commonly used for insulin resistance actually helps to lower the glucose level. That is something called metformin or glucophage. We use that very commonly in PCOS patients if they do have a pre-diabetic or diabetic condition, or sometimes it does help the patient's female hormones get in line and sometimes can increase their chance of ovulating when we're trying to help them get pregnant. So it's amazing how these things are interrelated, and using a medicine for blood glucose can actually help your female hormones get back in line and help produce pregnancy.
I believe back in 2015, there was a study done, and they titled it that the cure for Hashimoto's is here. Of course, I clicked on it, and it was metformin. Mm-hmm. So a lot of people with Hashimoto's, a lot of clients that I see, do take metformin even though they don't have diabetes. Mm-hmm. That medication has been shown to decrease inflammation, decrease blood sugar, insulin, and just make you feel better just by decreasing those things.
Yes.
So that's one of the options if somebody is looking to manage PCOS and Hashimoto's medically.
Yes.
Well, and then Nataliia, in previous episodes, I know we've talked so much about the Mediterranean diet. I almost forgot. I was going to call it the Italian diet.
That's close
So
enough.
how would that diet then help these individuals, right, that are trying to reduce the inflammation and all of that, if they want to choose a natural path versus taking the metformin?
Of course. So Mediterranean diet is considered to be one of the best diets for overall health, for decreasing inflammation, managing blood sugar and weight. So people, if somebody's trying to decrease blood sugar, you have to be a little bit careful with Mediterranean diet because it's rich in grains, which are very healthy, gut healthy, provide fiber, soluble and insoluble fiber, all the vitamins and minerals we need. But like I said, because it's grain heavy, it provides a lot of carbohydrates. So we have to be careful with portion sizes when it comes to Mediterranean diet.
Oh, great point. Excellent.
So we covered the blood sugar, insulin resistance, blood sugar imbalance. Now let's talk about gut health. And we know that gut health plays a huge role in balancing sex hormones like estrogen and reducing overall inflammation and creating a healthy environment for our gut bacteria. So healing the gut is essential in treating the root cause of PCOS and Hashimoto's, because with Hashimoto's, we're not really treating the thyroid, right? We're not treating the gland. We're treating inflammation, insulin resistance, and everything that we've been talking, all the signs and symptoms of PCOS, basically. So that's what I do all day long, is talk about gut health, Hashimoto's. So let's bring all of those tips into management of PCOS. First, number one is eat a variety of fiber-rich diet, right? We know that fiber is great for reducing even estrogen. It binds in our gut, binds to estrogen, excretes all the toxins that causes systemic inflammation. Of course, we need to remember to include probiotic-rich foods. If you tolerate it, that's like sauerkraut, kimchi. We need to, people can take multi-strain probiotic. And actually, the very recent study in 2022 showed that multi-strain probiotics, along with dietary and lifestyle modification, were effective in managing PCOS. So it was huge, showing just adding those gut bacteria, introducing it helped decrease all the PCOS-related symptoms. Of course, we need to think about limiting foods high in added sugar, right? That's our inflammation. Limit gut irritants like excessive caffeine and alcohol. We know that's a good thing for any disease. Spend time in and around nature, right? Because we haven't talked about stress, but we know that's one of the drivers behind any inflammatory or even autoimmune disease. So we have to think about that. And Kimberly, like you said, Mediterranean diet is one of the best diets. It's anti-inflammatory diet that we need to include in our PCOS lifestyle change. And Dr. Ellington, let's talk about the specific diet for PCOS, and let me know if you agree or not. There is actually no evidence that eliminating any food is necessary or beneficial for PCOS. There is research that cutting out foods without medical need can actually raise the risk for diabetes, lead to nutrient deficiencies, fatigue, and just harm your long-term relationship with food. So is there anything that you can add or clear up for our listeners as far as any kind of food avoidance or diet that they need to follow?
Well, if you deprive yourself of something, you're going to want it even more. So I always tell people take things in moderation. But again, trying to stay on that lower glycemic index just to keep the blood sugar down is mostly what we focus on.
Yes, and as we talked about the 4 types of PCOS that social media promotes out there, it's funny that the treatment for all those 4 different types of PCOS is the same. They teach you eliminate gluten, dairy, soy, and some other stuff, depending on what blog you read. So I have not found any research behind it. There's absolutely...
No, I haven't seen any research either. It's funny you keep bringing up soy because we see patients that are in the postmenopause that use soy to replace their estrogen. You need 3,500 calories of soy to be equivalent to 1 estrogen tablet. So you see how much of a volume you would have to have in some foods to really make a huge difference in what your hormonal content in your body is.
Absolutely. This is such a great point, and I did not realize that it takes that much. I mentioned that, if you're trying to raise or decrease your testosterone, you may want to get on medication because food is not going to do much. And now you're saying it's really not going to do anything.
In most cases, no.
Wow. So stressing out and being on the estrogen-lowering diet it's probably more stressful.
Exactly. Probably going to raise your cortisol level and make things worse.
And then, well, cortisol raises everything, right? Raises estrogen and everything. So, so you have to be very careful with where you're getting information from, what diet you follow. So, yes, listeners, I'm so glad we're recording this podcast. I think it's so important. So let's talk about the last thing, supplements. Studies do show that inositol and acetylcysteine, or short for NAC, and folic acid may improve the ovarian function in infertile women with or without insulin resistance. Is that something you guys do in your practice? Any supplements recommendations?
Well, the folic acid is something that we generally recommend to our patients of childbearing age because it also reduces birth defects of the spinal cord. But a lot of diets are deficient in folate despite supplementation by a lot of the manufacturers. So your point is valid that it also can help with keeping that hormonal balance.
Listeners, make sure you get the right inositol supplements. You know the quality matters. And just to see an example, you can visit my website, just allpurposenutrition.com. Okay, we have one more tip to cover. When you experience hair loss, guys, diet and exercise can also help manage PCOS-related hair loss. How, you ask? Well, as we discussed, a healthy diet can help regulate insulin levels and improve overall hormonal balance. So exercise can also help regulate insulin resistance and improve blood circulation to the scalp, right, Kimberly? Promoting hair growth.
Exercise is amazing. I always tell everybody, if you're having a hard time and you're limited on your exercise, just give me a couple of headstands a day, right? And that just drives all that circulation right there. It helps your skin. It helps your hair. It's perfect.
I know you guys do scalp treatments at HPI. Sign me up. Dr. Ellington and I need it after this episode.
I know, right? So yes, the stimulating scalp treatments that we offer actually are one of our first line of defense for clients coming in, just because it takes time to get the labs. It takes time if we're going to perform a tricho test, right, to check DNA preservation, to check, the lineage and where the genetics lie. Also, if we're performing an epigenetic test, looking at the gut and the circulatory system, all of those take some time. And typically, the individual is very concerned, and they haven't had any form of relief from all of the hair loss if they're in a telogen and effluvium shed. So they're experiencing a great amount of shedding. And so the stimulating scalp treatments are terrific for that. Also, detoxification on the scalp, right? No matter what you're doing, if there's inflammation in the body, it has to come out. And so typically the inflammation's causing a lot of extra buildup. Dry skin or either oily skin. Sometimes we'll see a lot of seborrhea, psoriasis, and then these detox treatments are extremely good. Both include the stimulating massage, right? So it's getting that blood flow to those hair follicles.
Fantastic tips. I hope, listeners, you found this podcast helpful, because PCOS, Hashimoto's, hair loss, those are complicated conditions that may require blood tests, right? And a whole team of professionals to figure it out. So no wonder people feel frustrated when they cannot figure it out. It's hard for us with all the tools that we have, right? So we have to work as a team, first referring clients that need help, right, from other disciplines. And listeners, don't forget, it's unlikely that you are going to find a single action that is a magical pill, right? We have to focus on fundamental first, like balanced meals, adequate movement, sleep, stress management, right? Medical treatment of the conditions that we've covered. So just remember, you're not alone. We're here to help you. Dr. Ellington, is there anything you want to add as the last, anything you want to leave our listeners with?
I think we've covered a lot of great topics, and I think your point is right on that you do need multiple people sometimes to help you to get where you need to be. But please don't get your help from TikTok or any place else out there on the social media. Please see a professional or, someone that you can really trust to give you the good information, not your best friend or their cousin who doesn't really have the medical knowledge or the dietary knowledge or the hair knowledge to really help you with your problem.
Absolutely, because what worked for that one person will probably will not work for you. Mm-hmm. So personalized approach is so important. Dr. Ellington, thank you so much for your time. Again, we're so lucky to have you on this podcast, and we hope you will join us next time.
I'd love to come back.
That's
Thank
great.
you for having me.
I have my calendar out, so let's go ahead and get that scheduled.
All right.
We just thank you so much. You have a great day, and we really appreciate, and we know the listeners are excited to hear what you've had to share.
Thank you for having me.
Bye-bye.